Good afternoon, ladies and gentlemen. Thank you for making time to join us as we present the 2024 benefit updates for Discovery Health, as well as the Ambulance Gap for Sasfin clients. Looking at our agenda this afternoon, we'll go through why Sasfin Healthcare Consulting, Discovery Health Medical Scheme benefit update. That will be done by my colleague from Discovery, Karunisa Ramsamy. Vitality update. On the vitality update, we are not going to present any vitality updates in this presentation. We do have two added vitality presentations. Emails should have gone out, or you would have received the email just to register for the vitality presentations as well. And then what I will go through is the Ambulance Gap for Sasfin clients, the way forward, as well as your important questions. So just under the important questions, please just stay online because it is quite important to understand your medical aid and all that. But we'll go through that. Perfect. So just on why Sasfin Health Consulting. So what we do to assist you as a valued member of Sasfin is we do help selecting the correct option for you and your family, understanding your benefits, which is really important because you're paying for something that you need to understand. Your resolution on escalated queries, we assist you, we represent you to ensure your medical aid scheme treats you fairly and in accordance to your benefit entitlement. Assistance to you employer groups. Employer groups, we assist with the industry development updates, your annual market reviews, HR and payroll assistance, and provide recommendations on related providers and solutions for the healthcare. Okay. I'm going to hand over to Karunisa from Discovery. Karunisa, thank you for joining us on this presentation or on this session. Over to you.
Thank you so much, Dion. Good afternoon, everybody. As Dion mentioned, my name is Karunisa Ramsamy, and I'm a corporate health manager at Discovery Health. Today, I'm going to be taking you through the 2024 benefit enhancements and the contribution increases that you will see in 2024. To start off today's session, I'm going to be taking you through the core purpose for Discovery Health. Discovery's core purpose is to make people healthier and enhance and protect their lives. This is fundamental to everything that we do. We always want to make sure we stay true to this core purpose. For the purpose of today's session, there's going to be 4 parts that we're going to go over. So the first one I'm going to touch on is the financial strength and sustainability of the scheme. I'll then take you through the contribution increases as well as the benefit enhancements you will see in 2024. Then I'm going to take you through the product platform and the benefits that we have available to all our members. And lastly, we'll close off the session with the digital tools and the digital enhancements that you will see going into next year. So to start off under the first pillar, I want to just elaborate a little bit on the Discovery Health Medical Scheme sustainability. And as many of you might be aware already, Discovery Health Medical Scheme is a very sustainable and solvent medical scheme within the industry. We're currently sitting at 29.4% with our solvency ratios and solvency rates. And if you compare that to what the South African requirements and the UK requirements are, we are currently sitting at 4.4% above the South African requirements and 15.4% above the UK requirements. When we look at the exceptional value that we offer to our members, and if we compare that with the rest of the medical scheme industries, we do see that Discovery Health Medical Scheme comes out at 96% higher in hospital cover ratios. And if you look at the rest of the open schemes, they are currently sitting at 90%. When you look at the benefits that we offer to our members and the contributions that we offer, and you compare that to the next largest open medical schemes within the industry, Discovery Health Medical Scheme comes out at 12.3% lower contributions. This really ensures that our members have peace of mind that should we be faced with another pandemic like we have, Discovery Health Medical Scheme will be able to sustain itself into the long term and allow our members or provide our members with cover for that claims. If we go on to the next slide, when we look at the contribution increases on a yearly basis, there is a strategy that's developed to ensure that we are pricing the medical aid correctly, to ensure affordability for our members, as well as long-term sustainability for the scheme. So for the 2024 contribution increases, what we have done is we've stuck to the three principles that you see on the screen. The first principle is that the risk contributions must increase in line with medical inflation. The reason why this is so critical for us is that we need to ensure that the contributions that we receive on a yearly basis are aligned to the possible payouts that we will have in terms of our claims that we receive. The second principle that we looked at is that the risk contributions increases allowed us to have varied utilization. And the reason why this was possible is if you look at the different plans that we have within the scheme, each of those plans have a different utilization trend to it. So based on the fact that it has different utilizations, we will be able to provide or apply different increases according to the utilization of those plans. The last principle that we looked at is that the gross contribution increases need to maintain affordability. Now, this is very critical for us because what we do understand is even though we need to increase our plans, we want to still ensure that the growing plans within Discovery Health Medical Scheme still remain affordable for our members, and it is something that our members can still afford going into the future. So the first principle that we spoke about is the medical inflation. And to just give you an overview of what medical inflation is, if we look at the next slide, you will see that the projected medical inflation for 2024 is currently sitting at 10.5%. The pillars or the graph bars that you see on the chart in front of you, those are the factors that actually affect medical inflation. So you have your yellow parts of the graph, which are all the factors that increase medical inflation. So for example, your tariffs, and that is the rise in the price of healthcare, and healthcare prices increase on a yearly basis. Then you have your supply side utilization as well as your demand side utilization, which are all factors that increase medical inflation. Then you have the parts that are reflected in green, which is the factors that actually decrease medical inflation. These factors are our risk strategic initiatives that we take from a medical scheme perspective. For example, our fraud interventions, our vitality program that we have, and those help decrease the projected medical inflation. So in summary, if we look at the medical inflation, we're sitting at 10.5% for 2024. And to take you into the increases that you as a member will be experiencing for 2024, we do see that we have a weighted average increase of 7.5% for the 2024 period. Along the schemes or along the plan spectrums, you will see that there is a different percentage per plan. So depending on which plan you are on, the increases you see in front of you will be accordingly. Just to highlight a few, for example, you have your Saver series below 4%, you have your Smart series at 8.9%, and your Key Care Plus and Key Care plans are between 10.9 and 9.9%. Holistically speaking, we do see that 39% of our members will see an increase that's below 4%, and 73% of our members will see an increase that's below 10% for 2024. Taking you into the changes that you will see taking place for 2024. So there's a few changes that we're going to speak to. The first change that I'm going to touch on is the change that's also tying in hand with the contribution increases. And this is the one, or this is aligned with the third principle that we used, which is that gross contribution increases need to maintain affordability. So the first thing, or the important point to remember here is that we are optimizing the day-to-day benefits on our Saver series. The reason this was so critical for us to actually do is because we have picked up that the Saver series is one of the fastest growing plans within the scheme, and we want to ensure that this plan still remains affordable for our members. So for 2024, the medical savings account on the Saver series will be reduced by 5% to accommodate for the lower plan increase that you will see across the Saver series. Going into the next few changes that you will see, the first change that I'm going to speak to is the changes to the comprehensive series. Sorry, I'm just waiting for the slide to load so I can speak to it. Thank you. The first change that you will see around the comprehensive series is the fair usage limit being applied to the above threshold benefit. So on the comprehensive series, there will be a fair usage limit being applied. This will be dependent on the number of dependents on your policy, and that RAND value will be indicated accordingly. The next change that you will see is to the oncology innovation benefit. So just to give you some background on that benefit, the oncology innovation benefit is a benefit that came into play a few years back. And this benefit was to assist our members who are currently receiving oncology related treatment, but do require to be on some of the very high costing drugs that treat oncology. So we did create this benefit to assist funding on these medications. Currently, how the benefit works is that we will pay a certain portion and the member has a 25% co-payment. Going into next year, certain of those drugs, there's a list of 3 of those medications where the co-payment will be increased to 50% for the comprehensive series. The next change our members will see is for members that are registered under our chronic illness benefit program. This change will require the member to nominate a primary care GP for the treatment of their chronic illness. I'm not going to go into too much detail of that now because I will speak to it extensively in a few slides ahead, as it does affect our members that are also on our other plans and not only the comprehensive plan. However, to touch on the last change that you will see within the comprehensive series is we are going to be simplifying the comprehensive series. So currently our members that want to select a comprehensive plan have 5 different plans that they can choose from. However, because the uptake on those plans have been very minimal, we are going to be consolidating the comprehensive series into 2 different plans. The first plan being the classic comprehensive option, and then the next plan that the member can choose from is the enhanced classic smart comprehensive plan. Now, if you are familiar with the comprehensive series, you will know that the classic smart comprehensive plan that's currently available does not have a medical savings account. But what we are going to be doing, if you look at the next slide, is that we're changing the name to cater for the changes that will be added onto the classic comprehensive plan. So the enhanced classic smart comprehensive plan will have a medical savings account portion allocated to it, and this will be at 15% of your total contribution, which members will be able to use for their day-to-day expenditure. What we are going to be adopting from the current classic smart comprehensive plan is keeping the unlimited GP consultations. So this will assist our members with keeping their medical savings account at a minimal, where we will be, members will have unlimited GP consultations with a GP within the SMART network. There will be a 65 Rand co-payment to this consultation, but that 65 Rand co-payment can be funded from the member's medical savings account as well. Okay. Going into the changes that you will see affecting the Key Care members. So our members that's on the Key Care plan will have a few changes that they need to be wary of. The first change that our Key Care members will see is to the GP benefit. Currently, our Key Care members have an option of selecting a primary GP as well as a secondary GP. The secondary GP, again, has not been something that our members have really selected. So what we are going to be doing is we're removing the secondary GP function, where members only need to concentrate on nominating a primary GP. Together with that, there will be a change to the out-of-network consultations benefit. So the out-of-network consultation benefit will be changed to 1 nurse-led consultation, and this will be done through our network pharmacies across the country. Should a member need to be referred to a GP, the nurse will be able to refer that member to the GP for their consultation. Another update affecting our key care members is the exclusion list. So we are going to be updating our exclusion list to add on any elective procedures for tonsillectomies, myringotomies, as well as adectomies. So very important for me to emphasize is that these procedures will only be excluded if they are voluntarily selected to be done or electively done. If it is a PMB or emergency related and these procedures are required, then it will still be covered on the key care options. The last change affecting our key care members is updates to the key care hospital network. So just to elaborate on that, there's quite a number of changes taking place on the hospital network. The list has been updated on our Discovery website. So if you are on the key care plan, I do encourage you to familiarize yourself with the list so you're aware of which hospitals fall under your network. Going into the changes that will affect the plans across the board. So the first one is the annual benefit updates that we make. So every year we do update our formulary list, our chronic drug amounts, as well as our oncology reference pricings. So these will be done on an annual basis. There will be updates to the benefit limits, thresholds, co-payments, and deductibles, and these will increase in line with the relevant medical inflation. There are certain benefit limits which will remain unchanged for 2024. And if you do refer to the bottom of the screen, you will see those benefits highlighted with the two double asterisks. Those are the benefits that will remain unchanged for 2024. One of the other changes affecting all our members is the nomination of a primary care GP. So I did touch on this when we spoke to the changes on the comprehensive plan. So to elaborate a little bit further on what this process would mean is that all members that are registered for a chronic illness benefit will be required to nominate a primary care GP going forward for the treatment of their chronic condition. This affects all our members except for the members that's on the on the executive plan. How it works is that if you are being treated by a GP for your chronic illness, you will need to nominate a primary care provider from our network. Should you not nominate a primary care provider or visit a non-nominated primary care provider for the treatment of your chronic condition, there will be a 20% co-payment applied to that consultation. Two important points for me to highlight under this benefit is, say for example, if you are a person that's diagnosed with a certain chronic condition and you choose not to go to your GP for the treatment of your chronic condition, but you rather go to a specialist, this benefit or this change does not affect that specialist cover. Your specialist cover will remain how it is covered as per your chronic benefit currently. This is only applicable to members that are receiving treatment for their chronic condition from a GP itself. The second point I want to highlight under this change is that, say, for example, you have selected a primary care GP and you require an updated script under your chronic medication. For whatever reason, you are not able to go to your nominated primary care GP, the benefit or this benefit will not affect the way your chronic script is covered. Your chronic script will still be covered as per how your chronic benefit is approved. The only thing that will be affected is the consultation with the non-nominated primary GP or non-nominated GP rather, where that consultation will attract a 20% co-payment. The last change that I want to speak to on this slide is the home-based hospital network. So what we are going to be doing for our members that's on the Key Care, Smart, and Delta plans is we are going to be introducing a designated service provider for home-based hospital network care. So what this is if you do recall, over the COVID-19 pandemic, Discovery introduced something called Discovery Hospital at Home. And this was where members would be able to receive hospital level of care and treatment in the comfort of the member's own home. So this benefit has been highly successful since it's been released. And what we are going to be doing is for these three plans that's highlighted on the screen, they will then need to be or required to be using these providers for home-based care. So there is a list of 8 conditions that are referred to as low acuity conditions, where if a member needs to be admitted into hospital for these conditions, at the point of authorization, the service provider will check if the member meets the clinical entry criteria and if the member meets the home-based hospital network criteria. Should the member meet the criteria, they will then be advised that they can be admitted into their own home for the treatment, or the member can be admitted into the facility. If the member chooses to be admitted into the facility, then there will be a deductible applied to the hospital account. However, if the member chooses not to be admitted into the facility and be admitted into their home, there will be no deductible applied to the account, and the hospitalization will be covered as per the authorization and the member's plan type. 2 points to highlight under this benefit is that if members do experience load shedding in their area, there will be a backup UPS system delivered to the member as well to ensure no interruption in terms of their treatment. And lastly, on this benefit is that members don't need to be concerned or worried about not being monitored. The equipment and the facilities that are sent through that will be installed in the member's home does come with the member being monitored 24/7. So medical assistance will be dispatched should a member's condition change or deteriorate while being admitted into their home. Okay. Going into the third section of today's presentation, I'm going to take you through the product platform that we have, as well as the benefits available to our members. So just to give you an overview of what is available from Discovery Health Medical Scheme, which some of you might be very familiar with already, this is the different options that you have that you can choose from. And how our plans work is that we have different series available to you. And from that series, you have different plans that you can choose from. So for example, I'm going to use the Saver series as an example. If you look at the Saver series pyramid, you would see that you have the Saver series, and under that you have 5 different plan options that you can choose from depending on your medical and financial needs, and then you will be able to select the relevant one for you. Going into our product summary and the benefits that's available to all our members, for the purpose of today's session, I'm going to touch on our core benefits as well as the wealth fund and explain these 2 benefits extensively. So if you look at the summary of our core benefits, and this is something that's available to all our members, irrespective of which plan you actually choose. The first benefit that you have is that we have unlimited cover for our hospital admissions. So what this means is, irrespective of whether you are on the highest plan or on the lowest plan, there is no overall limit to your hospital cover. So if you do need to be admitted into hospital, say for example 3 times in 1 year, we are not going to cut you off on your 3rd hospitalization and say you've reached your hospital limit. As long as your authorization and procedure is something that Discovery Health Medical Scheme covers, we will cover that according to your plan type. The second benefit that you will see available is that we have full cover for in-hospital specialists. And this is something that's very important, and I want to emphasize on exactly how this works. So on our plans, and like we touched on under the summary, you have different options that you can choose from. So if you choose an option that says classic, your payment for your service providers will be at 200% of the Discovery Health rate. If you select a plan that says essential, coastal, or key care, you will have a 100% cover of the Discovery Health rate when you are in hospital. What that means for you as a member is, if you are in hospital and say, for example, the procedure that the service provider is charging you for is 2,000 Rand. However, the Discovery medical aid rate for that procedure is only 1,000 Rand. If you're on a plan that covers you at 200%, we will pay for the entire 2,000 Rand. If you are on a plan that covers you at 100%, we will only cover you at 1,000 Rand, and the balance is for the member's liability. This is why it's very important, should you have planned procedures, it's always advisable for you to look or reference our medical and provider search tool available on our website, which will indicate the number of or the applicable service providers that do have payment arrangements with us, who will more than likely than not charge according to your plan type, and you will not experience any shortfalls on your hospital account or your service provider's account. Going into the third point is our chronic illness benefit program. So we did touch on a little bit on this throughout the session. But what our chronic benefit covers is that we have 27 conditions that are covered on all our plans, which is referred to as our chronic disease list of conditions. And then you have the additional disease list or additional disease list that's covered on the executive plans and the comprehensive plans. The chronic benefit doesn't only cover our members for your monthly prescription, it does cover you for a basket of care that can include GP consultations, specialist consultations, pathology, as well as radiology, which will be covered from the risk or rather the chronic benefit. And that will be indicated to you under your basket of care once you do send in your approval. Once you do send in your application, upon receiving your approval email, it will include a basket of care which will detail exactly what's covered under that. Then you will see that we do have a maternity benefit applicable to all our plans. Under the maternity benefit, you get cover for your consultations and certain scans throughout the duration of your pregnancy. And once you do deliver your baby, you do have certain consultations, for example, ENT consultations that are covered for the treatment of your baby under the maternity benefit. And this does not affect your day-to-day benefits itself. The baby does have certain consultations which will be covered for a period of 2 years under the maternity benefit. Then the last two benefits that I want to speak to is the screening and prevention benefit, as well as the wealth fund. I'm going to speak to these two benefits somewhat collectively because they do work hand in hand. So the first thing that I want to touch on is the screening and prevention benefit. This is a benefit that has been available to our members for many years within the scheme, and it is available on all our plans. What it does cover our member for is a risk cover for mammograms, pap smears, prostate-specific antigen tests, as well as a health check. There are certain limits that are applicable to this should members be deemed as low risk, and if members are high risk, then there is certain additional benefits that can be applied as well. So for example, the health check can be done twice a year. The health check is something that's done through a Dis-Chem and Clicks pharmacies, or alternatively, if you are on an employer group, it can be done through wellness days that's conducted at an employer. What it does cover our members for is blood glucose, blood pressure, cholesterol, and BMI testings, which is a screening finger prick test that's done at the pharmacies. This health check doesn't only give you vitality points, but it also tells you basically where your risk factors lie and gives you a brief overview of your medical assessment. Now, what we have picked up through the COVID-19 period is that a lot of members have stopped performing their health risks or health checks. We want to encourage our members to continuously do these health checks, and the reason we want to encourage our members to do this is what we've seen is that with the decrease of health checks being performed, we've actually seen a huge increase in members now being diagnosed with very high-end or later stages of illnesses, as opposed to when the screening tests were being done, it was actually being picked, or members were able to early detect illnesses, and treatment of that, of course, becomes much more bearable as opposed to later stages. So at the beginning of 2023, Discovery Health Medical Scheme introduced a benefit called the Wealth Fund. The Wealth Fund is a benefit that gives our members an additional portion of funds that can be used for additional screening and preventative testings. How it works is that in order to unlock the benefit, members are required to perform their health check. So all members on your policy that are over the age of 2 need to perform your health check. And as soon as that health check is done, it unlocks the wealth fund. Child dependents don't necessarily need to go into the pharmacy to do the finger prick test. There is a kids health assessment that's available on the website, which can be performed by the parent dependent. Once that fund, or once the health check is done and the wealth fund is unlocked, it unlocks an additional amount available to the member, up to a capped amount of 10,000 Rand, depending on your number of dependents on your policy, for you to use for additional screening and preventative testings. To elaborate on what testings are available, there is cancer screening testings that's available under this benefit. There's general assessments that's available. And just to explain how it ties hand in hand with the screening and prevention benefit, currently on the screening and prevention benefit, if a member goes in for a pap smear, the pap, the only thing that's covered from the screening and prevention benefit is the screening or the lab test that gets sent to the lab itself. When the members consult with the service provider, that consultation is either funded from the medical savings account or for the member's own pocket if the member doesn't have any medical savings. So with the introduction of the wealth fund, once the member has unlocked the wealth fund, that consultation can now be funded from the member's wealth fund and not use the member's medical savings account or assist them with that out-of-pocket expense. So that's how your wealth fund works. The last point that I want to mention on the wealth fund is it's very important for our existing members to be aware that this benefit is a discretionary benefit that was created, which is available from the 1st of Jan 2023 up until December 2024. It is a benefit that's only applicable for a 2-year period. So if you are an existing member, this benefit will no longer be made available post December 2024. However, if you are a member or a new member that's joined the scheme within 2023, or possibly joining the scheme from the 1st of Jan 2024, the wealth fund will be made available to you from the date that you start your membership, and the end date will be 2 years later. That's on the wealth fund itself, and that's how the time period works under the wealth fund. Okay. Going into the last section of our presentation this afternoon is our digital enhancements and the new digital tools that our members will see available to them. So the first thing that I want to, or the first point that I want to mention, is that we have introduced a new Discovery Health app. The barcode that you see on your screen currently, you are able to scan that barcode and it will take you to the new app that is available. The app has been made available since the end of September. So if you have not updated the app as yet, you are able to go through and update it on your phone to get access to the latest features as of 2024. Going into 2024, there's a few changes and updates that you will see once you've downloaded the new app. The first benefit that I want to speak to under the new app is Speak to a Doctor Now. This benefit has been created for our members that do require emergency or medical assistance after hours. So this will be a function loaded onto the app where if a member does need medical assistance after hours or just is unable to drive to a doctor, they are able to go onto the app and they'll be able to click on Speak to a Doctor Now, which will then be able to connect them to one of the emergency room doctors that's available 24/7. We do have a specific panel of doctors that will be linked to the app. And if the care is deemed as urgent, it will be funded from the member's risk benefit and not affect the member's day-to-day benefits. Important to highlight under this benefit is that the doctor will have an option to be able to provide the member with an electronic script. So should the member need a prescription, the doctor is able to e-script them. And if the member wants to get their medications ordered online, there is an online pharmacy tool that is also added on there where the member can choose to get the medication delivered to them, or they will be able to select an in-store pickup if that is more convenient for the member. If you look at the middle column of the slide, we have a virtual physical therapy benefit that's also going to be added onto the new app. And what this benefit is it assists our members with those members who require physical rehab recovery. Should a member have a minor injury and say, for example, maybe only requires 3 sessions with a physiotherapist, but unfortunately, due to the reasons known to the member is not able to physically drive to the physiotherapist. We have an AI functionality or AI platform that's uploaded onto the app, where the member will be able to do the physiotherapy that's required in the comfort of their own home or wherever the member sees fit. Due to the AI functionality on the app itself, what happens is when the member is doing the exercise, the AI platform will actually be able to indicate to the member whether the member is doing the exercise correctly or whether the member is doing the exercise incorrectly, and it will help guide the member accordingly. So that's also going to be available on the on the new app. The last change that I'm going to speak to under this section is the digital therapeutics on depression. Now, this is quite a number of things I'm going to mention, and this is tying in with our mental well-being programs that we currently have running. The reason why we have enhanced this benefit is we want to proactively assist our members that are currently suffering with mental well-being illnesses. And the reason for that is what we have picked up is that members don't necessarily proactively get assistance. It's more of a reactive approach where they reach out only once a situation occurs. So what we have picked up in terms of our stats is that in terms of mental well-being issues and suicide rates, over the period of 2019 to 2021, we've picked up from research that under the age group of younger than 30, we have seen an increase in suicide rates to 159%, and which is very scary numbers. And if you look at the age category between 40 and 50-year-olds, we've seen about a 70% increase in suicide rates there. So we want to ensure and educate our members and ensure that our members are fully aware of the digital tools available to them for these conditions. So we've adopted the digital therapeutics for depression. To highlight what digital therapeutics is, digital therapeutics is a treatment class of medication. It is not just downloaded content that a member can go on from a specific site and download and just read up on content. It is actually a treatment class of medication which needs to be prescribed by a medical professional. So what we are updating on the app is that we are going to be updating a mental well-being assessment. That mental well-being assessment can be done by our members at any given point. It will then categorize the member into 3 different sections. The first one being low risk, then you have medium risk and high risk. Under those categories, depending what you are categorized as, there will be additional risk benefits that the member will have access to, where, for example, you will have risk consultations that can be covered, and then the member will be able to access the digital therapeutics once that has been prescribed by the medical professional. If the member is categorized as low risk, they are more than welcome to take the assessment at any given point as however many times that the member does require. The last point to mention on this mental well-being platform is that there is also a helpline available for our members through the app itself, which is available 24/7 to all our members, irrespective of which plan you are on. Taking you through the one of the other updates that you will see is our personalized health pathways. So this is one of the other benefits that all our members will have access to. And this is a very exciting benefit for our members. So what we have done under the new app is that we've adopted our gaming modification that we do have that's available on our other Discovery products, namely the Vitality product. And what we've done is we've incorporated it into the health system. So say, for example, if member has just found out that they are expecting a baby, they will then be able to go into the personalized health pathways section on the app. They will input pregnancy, and then the app will actually throw out the next best actions for the member. So for example, it will advise the member to maybe register their pregnancy with the medical aid, ensure that they make an appointment with their gynecologist. And once the member performs or completes all those next best steps that's indicated on the app, the member will be able to redeem rewards or claim back rewards from the service providers that you see indicated on the screen. To use a not so prolonged example, say, for example, if the members felt ill and they went through to the doctor confirms that the member has a touch of the flu. So if you input that into the app, it will then throw out, for example, next best actions as maybe possibly going on to a dose of antibiotics, or maybe getting the flu injection to assist with the conditions that the member is facing. Once the member has completed that next best actions, again, the member will be able to redeem their rewards and get the vouchers that's applicable to them for completing those activities itself. Again, to reiterate, this is available to all our Discovery Health medical scheme members as of 2024. To summarize and close off the session from the Discovery Health medical scheme side, the new digital tools that you will see available to you is the virtual urgent care, the virtual physical therapy, as well as our digital mental well-being assessments that I've touched on. Some of the additional benefits that you will see is the online pharmacy that you will have access to. There is an emergency assistance button on the app. Should you require medical emergencies, you can just click that button and medical personnel will be dispatched to your location. And then you also have a functionality where you will be able to check your symptoms. So there is an AI platform that's inputted into the app where members will be able to input their symptoms that they are suffering with, and it will then be able to guide the member onto what a possible diagnosis would be, or whether they do need to visit the doctor. One of the last benefits that's available on the new app is if you are a Discovery member that has multiple Discovery products, you will be able to interchange between your Discovery products. You will no longer be required to have multiple different apps on your phone. You will be able to have one app on your phone and interchange between the certain Discovery products that you actually require, and it will take you into that relevant workbench. That does bring me to the end of the Discovery Health Medical Scheme section. Thank you so much for your time. I'm going to hand back over to Dion. Thank you, Dion.
Thank you, Karenisa, for this insightful information. I will now go into GAP detail a bit more. GAP for SaaS and clients, understanding the value of having GAP, a GAP policy. So as a medical scheme member, you would expect the medical aid to pay your in-hospital bill in full, but that's not always the case. Like Karenisa mentioned earlier, is the 100 versus the 200% in hospital. Now, if you're not going to follow the Discovery or any scheme rules, or look for a provider on the scheme's network, the benefit of your specialist and your nephrologist will definitely charge private rates. So it's extremely important to understand that the core benefit on a GAP product is regulated at 198,606 Rand and 43 cents. What will be paid out of this annual limit is your in-hospital specialist shortfall up to 600%. Your any co-payments and deductibles, your in-hospital co-payments, levied against a scheme funded from your overall annual limit. So basically your MRI scan, your CT scan, your scopes, with a deductible will be covered out of this annual limit. Scheme sub-limits will be covered for the defined in-hospital limit imposed by your medical scheme. Under oncology benefit, it will cover the co-payments once your sub-limit kicks in on your on oncology benefit. And then also what is covered here is your dental reconstruction. So under the dental reconstruction, there is a limit available for the cover in, for the reconstruction cover in hospital that is related to oncology or trauma. Now, trauma is basically a car accident, mugging, that sort of thing. So if you have a claim on your dental reconstruction, please get in touch with your consultant, your Sasfin Health consultant. Okay. On the casualty ward benefit will cover the cost of medical surgical procedure following an emergency as well. That is your basic core benefits on gap cover. It is definitely advisable to talk to one of the consultants, the healthcare consultants at Sasfin, just to understand more on the core benefits. On the value-added benefits, as we call it, the bells and whistles on gap cover, is your severe illness benefit, which is really important to understand, is that there is a 50,000 Rand lump sum cash benefit on your first diagnosis of cancer. Also need to understand that this severe illness benefit of 50,000 will lapse at over the age of 65. So if I turn 65, I will not have this limit available. One thing that I really enjoy on this benefit is your premium waiver benefit, is that if I pass away, my family will be covered for 6 months a medical aid contribution as well as 6 months gap cover contribution. That will be paid over in a lump sum amount over to the surviving spouse. On the premature birth benefit is payable for premature birth of 42 days or more before due date. This is the benefit that's increased for next year. All marketing material or all material will go out in the next 2 weeks. Boston online home education will be covered as bells and whistles. The online is for the CAP support for grade 10, between grade 10 and 12. Discounted Cambridge International curriculum, and as well as your career guidance. ER24 is the bells and whistles, what they would say. That's your mental health self-assessment screening, your lifestyle self-assessment screening, as well as your ER24 emergency button. On the gap cover, obviously we will send the information later on the increases. It is group specific as well as individual members. But it is so important to understand that you need gap cover. Gap cover is not a luxury these days. It's more of a need these days, especially with specialist charging private rates. So just on your way forward, looking at your healthcare, you're listening to Karenisa and listening to myself on the gap cover as well. Just to what you need to understand way forward is important points to remember is check what hospital cover your plan offers. Ensure that you are aware of any exclusions on your selected option. Check your reimbursement rate. That is important to, again, reimbursement rate is quite important. Do you need extra network or specific hospitals, or are you free to choose which of hospitals? You need to understand your Delta plans is network related. If you do not want to go to a Delta network, you will have an upfront payment. The co-payments and deductibles will be applicable, so please make sure you understand your plan. Check what oncology cover your plan will offer. Remember, your oncology program will work day from diagnosis. It's a 12-month cycle. Please make sure on the co-payments and limits, look at gap cover for the additional 20% payment. Check what chronic conditions is covered on the plan that's offered. Remember, your 26 PMB-related conditions must be covered by the scheme, but you also have to follow the scheme rules. You need to use the designated service providers for pharmacy, for doctor's visits, to avoid any co-payments. Also, what you need to consider is the amount of out-of-hospital cover you may need in 2024. My needs, your needs is completely different. I have 2 kids and a wife. My kids is small. My day-to-day benefit lasts me until about April, May. So I need to look at increasing my cover for my day-to-day benefit. Also, what's important to understand is you need to be, if you look at downgrading, you need to be prepared to use network hospitals, network facilities. Specialized dentistry is expensive treatment. If there is in the future specialized dentistry, please look at the option. Please chat to one of your healthcare consultants to assist you with needs analysis, your personal needs analysis. What you need to consider is as well as dependents turning 21. So on Discovery, it is if a dependent turns 21, it is seen as an adult dependent, whether it's a student or not. Look at different plans, chat to your consultant, look at different plans that will be more affordable for you as a family. Also, consider addressing potential gap covers. Gap covers, I cannot stress more on gap cover, how important it is these days. Option changes. So on your option changes will close on the 30th of November, 2023. How you can change your option is that you can do it online, or you can change it via the Discovery app. Download the Discovery app. It's available on all Apple Store, Google Play, as well as your Huawei stores as well. Download the app, run your look at your profile, and then change your option. So, guys, that is from my side. Get in touch with your healthcare consultant. Let's talk about your needs, your specific needs, if you want to change your option, especially if you're looking at your classic comprehensive option, or if you're on a classic Delta comprehensive. Please get in touch with us so we can guide you through the process of changing your option without changing your benefits. Unfortunately, I can't see any questions on my side. Karenisa, are you able to see questions on your side?
Hi, Dion. Yes, I do see one question, and it's just to know if the webinar will be recorded, and I do believe that is being recorded. If you can maybe just let them know how they can access that recording.
Yes, webinar will be is recorded. So that it is recorded. It will be available on the Sasfin website. We also have 3 more sessions throughout the month of October. So if you can make those sessions, it would be appreciated. But a recording will be available on the Sasfin website.
Thank you so much, Dion. Dion, there's another question that's come through asking, what is the gap cover rates?
Gap cover rates, I think it's if it's individual rate, just get in touch with us so we can give you a quotation on the rates. Group rates is different from individual rates, so try to get in touch with me.
Perfect. Thank you. I don't see any other questions coming through.
Well, then, okay, we've seen that, gap cover, and then chat. Any other questions? I think that's it. Ladies and gentlemen, thank you so much for making time to sit with us through the presentation. We will be available throughout November and early December. Please get in touch with us. Let's put you on let's get you on the right plan. Let's see where your shortfalls is. Let's help you out. Thank you, Karenisa, for joining us. We will
Thank you so much.
Thank you so much.